right. Thank you again, everyone, for coming. I hope this is beneficial. This is the first lecture that we are giving as part of a year-long educational series on cancer. These are talks for people who have cancer, family members, people who are not doctors, people who need to understand what's happening in plain, simple terms so that you can make better decisions or change your views on cancer, help someone you know who has cancer. So let me make sure I can run my slides properly. And is that going? Thank you. So I call this Cancer 101, like some kind of college course, your introduction. I'm going to talk about specifically some of the terms and ideas. Before I get into speaking about these ideas about cancer and some of the basics, I want you to know a little about us. I'm a medical oncologist, meaning I treat cancer with medicines. I'm an internist and then an oncologist and have had that kind of background training. In the back is Dr. Benjamin Mao, who is our second medical oncologist, hematologist, who trained at NUH and at the Mayo Clinic in the US for 7 years. And is Dr. Wynn back here as well? We also have an expert in palliative care medicine who's joined the West Clinic to help us in the toughest cases through the spectrum of cancer treatments. The West Clinic itself has been around for nearly 30 years. This is an American group. We've got nearly 50 doctors, 20 of them cancer specialists across medical oncology, gynecologic oncologies, radiation oncology, pain management. And the West Clinic has been instrumental in helping us establish ourselves as a West Clinic, a West medical group here in Singapore. About myself, I don't enjoy this slide. Someone on our team put it up. And it lets you know that myself and the doctors that I work with, we're all very well trained. We've spent a lot of time in education and in seeing patients and in academics. But what we truly enjoy is helping patients and their families battle and win the battle against cancer. So today, what are we going to talk about? I want everyone to understand what is cancer, because that is an incredibly difficult question that I'm not sure I have the answer to, but I can give you some thoughts and perspective about how to think about that. We're going to talk about how do you get cancer or why do you get cancer in some straightforward terms. We're going to speak about treatments of cancer in a big picture view. Nothing is going to be, you know, here's the name of the medicine or the dose. This is not a microscopic level. It's a broad view of how we treat cancer. What's new in cancer treatment? Why does cancer come back, and what does that mean? If you've been treated, why do you still get medicines or see the cancer doctor? So we'll talk about how cancer persists or comes back. And something that's very important to us at the West Medical Group is your rights as a patient, because being an American group, we view the doctor-patient relationship perhaps a little bit differently than is viewed stereotypically in Asia. There are opportunities for decision-making where we can be partners and opportunities where the doctor should tell you what to do, but we want to make sure there's always an open discussion between doctors and patients. So what is cancer? In a nutshell, quite simply, cancer are cells that are growing out of control. Cancer cells up here are growing out of control. Normal cells, healthy cells in your body, they're supposed to do one thing at the end of the day. They do their job, and then they're supposed to die. So a cancer cell is cancer or a tumor is accumulating too many cells. Because normally, and it would be quite normal, if someone in the audience told me they were 250 years old and that they were never going to die, we wouldn't think that's exactly normal. So life and death are intertwined, and cancer cells are supposed to die. There's a fancy medical term for that. So over here it's called apoptosis, but what it really means is cell suicide. That at the height of any cell's maturity, they're supposed to say, I did my job, it's time to make daughter cells, and time for me to go. So cancer is cells out of control or growth out of control. Why does that happen? Well, it happens for a whole host of reasons, but one common reason is that the DNA, the genetic material inside a cell, is not doing its normal job. When cells make mistakes, when they copy themselves to make a daughter cell, the cell actually checks itself, as if I was making a photocopy, a Xerox copy of a document. You look at it and says, hey, this looks like the first document I made. But if you make a photocopy 1,000 times, you might notice that it doesn't look like the first document after a while. When cells do this and they say it doesn't look like the first document, that cell is supposed to die. There's actually a proofreader inside the cell that says, hey, you did it right or you did it wrong. And if you did it wrong, the proofreader says you're supposed to die. So one of the most common mechanisms, common ways that the genes go wrong is that we get a mistake in the proofreader. If the proofreader goes away, then no one knows that you've made other mistakes and you keep accumulating genetic problems. So what we have here is a simple cartoon that shows things like radiation or viruses or chemicals can affect our DNA. And if a mistake is made, hopefully that cell dies. But if the mistake is in the proofreader, then that mistake accumulates and more accumulate, and the DNA itself begins to get abnormal. And that's one of the background causes of cancer. What else happens? Cancer has to obtain certain abilities to be dangerous. It's not just enough to keep growing. So if a cancer cell keeps growing, say, on this table, bigger and bigger and bigger, that's not nearly the threat as if it figures out how to go through the table and make roots in the floor. So one of the hallmarks of cancer is invasion. So the two things are they grow out of control and then they invade. They go places where they're not supposed to be. So if the cells started out up here where they're supposed to be, but now they're starting to go into places they're not supposed to be, and then they're really invading into places that are not helpful. They might invade into bone, or it might get into the blood, and then go to other organs and cause destruction there. So again, what is cancer? Cancer is spreading, cancer is growing out of control, and cancer is very clever. It's diverse. It can figure out ways around our treatments at times. It's important that we begin thinking about cancer where it starts. So I'm going to talk in a minute about naming, but the cancer could be, for example, spreading a melanoma that starts on the skin. But if it gets into the blood and starts traveling, it might go to the liver and set up some colonies there, or known as metastasis. Or it could travel to the brain and create metastasis. So metastasis means that cancer cells have made a tumor somewhere else. Spreading through the blood is not a good thing, but let's put it in perspective, because a lot of patients ask, if I have surgery, will the cells go through the blood? I see patients every now and again who say they don't want to do anything because if we operate, then the cells will go through the blood. But the analogy here is that if all of us got into lifeboats to go to Sentosa, some of us would make it and some of us wouldn't. And even if we got to Sentosa in our lifeboats, would we be able to survive on Sentosa? So just traveling through the blood is not enough. The cancer cell must find a nice place, a nice spot in the lung that is hospitable for the cells to then grow and keep growing. So we're always on the look for cancer cells that travel.